Wow, so we're just ending our 82nd scientific sessions here in New Orleans, and wow, what a meeting! And so yeah, I'm curious, like, what are some of your impressions? How was it? What was exciting? Nuha.
It was a wonderful conference. It's actually very hard to pick what was exciting. Goodness,
So much stuff.
If you go by themes, I found the ADA-ESD Joint Statement of Hyperglycemia such a wonderful session. You know, the wholesome approach, including sleep and other factors, were all very wonderful things. Emphasis on weight, newer agents. It was very exciting.
Yeah, and it was that session was sort of the draft of this joint thing by the two big diabetes organizations in the world. What care should be like for people with type 2 diabetes?
Absolutely. What a wonderful collaboration. I love the actionable images and the approach to make it very applicable primary care colleagues. Really an effort that was quite impressive.
Yeah, no, I agree, Laura. You were all over the place. So what grabbed you?
That indeed. So I think as a certified diabetes care and education specialist with that background, I think one of the most important things to me was our opportunity to partner with the Certification Board for Diabetes Care and Education. And we had a nice symposium. We had the brand new standards that were just published in 2022 for diabetes self-management, education, and support. Lots of good information there. And then the CBDCE, we had a panel convened of interdisciplinary certified diabetes care and education specialists, and let me just say, wowed the crowd.
Yeah. Oh, nice. What was it about it? Just getting everyone together, or?
I think it was A, getting everyone together,
yeah.
And then B, just a lot of questions and uncertainty about some of the changes, both from the standards for DSNES as well as the COVID response to the hours that you have to collect for certification as a diabetes care and education specialist. So,
because these are sort of the rules that everyone in the country has to
absolutely.
sort of deal with, and first time hearing about it in person and
That's
able
true.
to ask questions.
And then even outside the United States, people have interest.
Yeah.
So we have to figure out how to guide them, because we only kind of stick with the standards and the certification within the United States.
It's a U.S.-based thing,
yes.
Right? But it's applicable around
absolutely.
the world. Yeah,
and it improves quality.
Yeah. Marlon, research. Just a little bit of that at this meeting, huh?
The science was amazing.
Yeah.
Amazing. I think one of the nicest things about the meeting was actually to be together. People coming together. I mean, you know how you get this collaboration, this engagement, and how science moves forward? You don't have everybody come together, and everybody spoke with us. We were saying how great it was to be connected, to all the meetings, all the excitement, and so on. And the science was great. There was so much science. I thought the Surmount trial was. I mean, we had 2 New England Journal of Medicine papers that came out.
Simulcast.
2. I mean, that's amazing.
Right.
Yeah. And one of them was Surmount.
Yeah. Which was sort of the tirzepatide.
Tirzepatide. Yeah. The whole story, the incretin story, and how that's continuing to unfold, and how now we're seeing the benefits of tirzepatide. We saw it in type 2 diabetes and weight loss. People that took the drug, they saw some weight loss, so they said, well, let's try it now in people who don't have diabetes or have pre-diabetes. And they found dramatic weight loss to the point where people now actually who were pre-diabetic reverted back to normal glycemia, which is like stunning.
Yeah,
stunning.
That really, like Nuha in the clinic, I'm sure you can imagine, wow.
Extremely excited for our patients. I mean, we were excited with newer medications coming out and changing, the limited medications that we have, but now there is plenty of choices. And with tirzepatide, 20% or 22% weight loss, that's impressive.
22%?
That's impressive.
Wow, that is a lot of weight loss, right? Like in the study, it was something like 49 pounds.
Yes.
Wow.
And in the symposium, as they were discussing, this is just the beginning, because the incretins, apparently, there's so many incretins, and this is the combination of GIP
of 2 hormones.
And they're saying the future. So this is going to to be a fascinating future for
It's just
weight
breaking
loss
open
and so on,
the
just
field.
breaking it open. So very, very
A
exciting.
whole new class.
So yeah.
Yeah.
And kidney, benefits in kidney.
And kidney. yes,
Right,
absolutely.
yes, that was an important thing to see because, you have great weight loss, but will it have the benefits of the GLP-1 drugs that have both kidney and cardiovascular and yes, so far on kidney.
Yes, and we look forward to hear the results on the heart.
Yeah,
cardiovascular.
right, that'll be the other big, there was also a lot of cool technology stuff
Absolutely,
that was
absolutely.
happening.
I'm really excited about technology, and the world of technology is almost evolving at a pace that it's difficult to keep up with. So a meeting like this really provides us with tidbits, with promising data. For example, the use of CGM or continuous glucose monitoring in the hospital setting.
Yeah, that was all
Amazing,
over the place,
amazing.
right? There was
Yes,
a
yes,
lot of stuff
yes.
about that.
And as a nurse by trade, I can see it being very helpful to nurses in the
Yeah,
hospital setting, so that you've got that continuous monitoring and really the reduction of
alarming,
hypoglycemia.
yeah, right, yeah, yeah.
So
Because nurses are so busy, it's like,
Absolutely.
yeah, they need.
absolutely, and we do need to reduce the events, the hypoglycemic events in the hospital setting.
Yeah, there's a lot of, and Guillermo Pierre's talk about inpatient diabetes management and presidential address, that
Mhm.
was also incredible body of work.
Excellent.
So really,
Excellent,
better care in the hospital was another biggie.
absolutely.
Yeah, the other thing that I thought was exciting is in the technology world was it not only continuous glucose monitor, but ketone monitor as
Ketone
well. Yes, that could really be valuable for a whole variety of reasons.
Well, and really and truly, if it can prevent DKA, for
Yes,
example,
yes,
then that helps in terms of hospital
yeah,
admissions.
preventing
And
hospital
exactly,
admissions,
and then even just the negative impact that it has on a person that experiences DKA, especially recurrent
yeah,
DKA.
right. If there's an early warning system, like watch out, you're going to get into
You're not
DKA.
taking the right
Yeah,
things.
right, exactly.
Yeah, how would this impact the patients? What's new for the patients?
For the patient
Yeah,
terms
in
of
terms
CGM.
of CGM.
So one of the interesting and very promising bits of information or data was the fact that one of the companies with the implantable is looking at, I think currently they're approved for 90 days or 3 months. And they're
Sensor,
evaluating the
yes,
sensor, Sensonics.
Yeah.
And they're evaluating a 6-month window of time for the implantable continuous glucose monitor, as well as a year,
yeah.
365 days.
Imagine not having to wear anything. Right?
Exactly.
Like it just
Exactly.
sort of there, you go for the small procedure and
Right. And I also learned too that it can be helpful in people that experience visual loss because it vibrates. So with the alarm set in the appropriate manner, it will vibrate to alert that person.
inside.
Absolutely, even cars.
Yeah, hard to ignore that.
I
Yeah,
thought that was exciting.
yeah, I thought so. I thought so as well.
But in the context of the technology and so on, I've been coming to this meeting for years, even prior to being ADA, and you sit in these session rooms, you listen to the science, you go to the posters and so on, but then you see over time, this makes it to the exhibit hall. And you see the actual technology,
Real products,
so things you've
yeah.
seen actually on the posters,
Yeah.
in the talks and so on, get translated. And you go and see the exhibit hall, and you sort of see, oh wow, look at that, they made this into a product. People are using that. This is something you can hold now, like a device that you can wear, like a AAD device with fluorescence and like a pressure magnet system and so on. They're real.
That really
Yes,
is.
that's the thrill for me about this meeting.
And I think the other thing that's really important to continue to reinforce is that data are good. It allows us to provide evidence-based practice and guidelines for our people with diabetes. And we want things to be safe. We want to learn. We want to know so that when it does get out there, that it's safe and provides the most optimal outcomes for the patient.
And knowing how to use it,
Absolutely.
all of that is really key. The other thing I was excited about, ADA has been supporting Pathway to Stop Diabetes for a number of years, and those presentations, those quick 10-minute like tastes of like, you know, Marlon, you were there.
Yeah,
Eating
it
that
was
up,
the first. It was
yeah.
the first day of the meeting. You know, these are amazing researchers, and you know, they have such great science, and these are the brightest, absolutely the brightest and the best, no question about it. And we had them present 10 minutes, like a rapid fire, 10 minutes each, to kind of say what's the gist of what they're doing. And I mean, I think, for example, Mei-Lin Chang, you know, and her work, you know, we supported her to do research on foot ulcers, and she's actually now developing a drug. She's our funding has helped her get so much more funding. She was talking about like $4 million coming in to help her do this clinical trial. You know, it's $7 million coming in to do another to take this further. So she's getting funded now to do these major clinical trials to show that
And she started doing this at the basic science level, understanding the mechanism, and now is taking that and literally going to clinical
Yeah,
trials.
so it's really exciting, you know, because we have a mix of really great researchers and so on. I mean, that's just one example of the Pathway program. So we're very proud of it. You know. It was great. It started the whole meeting that morning, the Pathway Symposium, and then it just got better and better
Yeah,
and better.
right. That was a great sort of kickoff for
Yeah,
things. And, you know, I think one of the big stories, you know, that we saw is tirzepatide. I know we already talked about this, but, you know, obviously that was headlines from, you know, CNN, USA Today. Yeah, where do you think this is going to fit in, Nuha, in terms of
You know, how
managing our patients?
Yeah, you know, I do a lot of lifestyle medicine. And,
Yeah.
you know, some people, I mean, I can think of who already in my clinic needs it.
Yeah,
You know, there are some people, they know GLP-1s, and there are people who need more help.
more
More potency. More potency. So
Yeah.
definitely, and, you know, now, you know, with the renal benefit as well, you know, gives you another whole, you know, section of patients.
Yeah.
What was exciting too is this beta cell replacement.
Yes.
The whole area. I mean, it's so
Curing
early
diabetes.
days.
Yeah.
Very early days,
Right.
but the initial data is so exciting.
Very exciting.
Yes.
You know, especially the stem cell approach to kind of providing fully differentiated beta cells to people. And there's such early data, and it's so impressive.
Yeah.
A lot of hope.
I mean, obviously, it's so early stage, early days. We need to see how it goes. But I think I saw the CGM traces of that first individual
Yeah.
that received beta cell replacement. 99.9% time in range.
Time and range, right, like literally every, you know, and you think, you know, they can take, I mean, it's almost science fiction, like a blood cell, devolve it into a stem cell, grow it into a beta cell, and put it into some.
Unlimited supply, whereas
Right,
now, you know,
unlimited
before you had to
supply.
wait for
Right.
cadaveric transplants, now it's,
Right.
the potential is there.
You know, we're excited
It's
about all
exciting.
of this, and I think the other thing that we came here to do was learn. Dr. Bob and I were talking earlier about the increase in suicide rates for individuals with type 1 diabetes.
Yeah,
So I
sobering.
think what we have to do is remember, you mentioned the message of hope. We have to continue to really make sure that we, in our roles, are mentors to promote mental health so that our patients with diabetes have resilience along with their diabetes, and, you know that they're not perfect, because no one is.
Yeah.
And it's not a mental health provider issue. I mean, the entire team needs to be involved,
It's
everybody,
screening, work
yeah.
together.
Yes,
This
yes,
is-
yes.
Ask the right questions.
Absolutely. Appropriate screening
yeah,
in clinic.
right.
It's very.
Yeah, because the numbers were scary. Wow, we could go on all day, and maybe we'll do another one of these. But what a meeting! I mean, you know, thousands of people here in person, 1,000 posters, hundreds of talks. I mean, I'll tell you what really excites me is how we're going to take what we've learned, put it into practice, and next year in San Diego. That's going to be great. So see you all in San Diego.